Philips Interoperability Solutions is at the forefront of the IHE-based open standards for data exchange across multiple care settings, where it has been making good on the promise of care collaboration for all members of the clinical team. And it has been applying this approach for more than a decade, gaining experience both regionally and internationally with prestigious institutions around the world. Today, information can be found everywhere in organizations, especially in the healthcare environment. So ask yourself, how many point-to-point connections does your enterprise have? The complexity of this ecosystem makes it hard for healthcare professionals to find the right patient clinical information. How much time do your clinicians spend reaching out to referring providers because information is missing? The answer to challenges like these is to enable seamless exchange of patient data. Philips Interoperability Solutions has developed a tailored platform based on open standards, one that works as a foundation for your IT ecosystem. It enables an information flow tailored to each customer's specific workflow, bringing together data from multiple vendors and sources in a scalable, future-proof platform, one that evolves as your organization grows, so that the right data gets to the right people at the right time. Let's look at a typical case. A patient away from home experiences acute chest pain and is admitted to the nearest emergency unit, which is in the city hospital. The attending physician immediately orders an ECG and a blood pressure test to assess the patient's condition and decide if an urgent procedure is needed. Fortunately, the diagnosis shows that the situation is not critical. The patient then tells the physician he had some examinations at his local hospital just 2 weeks ago. The physician naturally wants to see these images, along with the rest of the relevant clinical information on the patient, including checking the meds prescribed by the patient's own physician in the local hospital. Patient consent was already requested. Clinical information is exchanged between the two hospitals, giving insight into the patient's previous examinations. After further examinations, including an echo and blood tests, a more accurate diagnosis is made. If the acute condition continues, medication may be prescribed and an MRI performed to determine the most appropriate next steps. A report can now be generated, and all this clinical information can again be shared between the two hospitals. Since the patient does not need an emergency procedure, a referral is made to a specialized hospital at a different location. Some days later, the patient visits this specialized hospital and talks to the cardiologist, who will also need access to the clinical information shared between the two other hospitals. This continuum of procedures happens every day, with clinical information on hundreds of patients flowing through the network. With clinical information on hundreds of patients moving through networks like these every day, we need to streamline data exchange and communication between different systems and even different hospitals. Philips Interoperability Solutions enables true care collaboration across the entire healthcare continuum, and this provides a network of care around the only person who really matters: the patient. Innovation and you. Philips.